I'm sitting here with Boo and Tag. This is Boo. This is Tag. They are litter sisters. They are almost 10 years old. Well, I know, you're a very good girl. They play a big part in the story I want to tell you about caring for older dogs with heart disease. I guess Boo is not going to listen to the story, but that's okay. She's an independent girl. So I get an awful lot of questions on my YouTube channel about caring for older dogs, especially with heart disease. And with Cavaliers, as well as with several other breeds, heart disease is something that is fairly common to the breed and has to be taken into consideration, especially when the dog gets older. So what do you do? What do you look for? Where do you go? Please keep in mind, above all, that I am not a veterinarian, and all I can do is speak to you about the experiences that I've had and give you my opinion and explain what I do with my dogs as they get older and often need care for heart disease in their later stages. You should always start with your general practitioner veterinarian. Your vet may very well determine, when your dog is older, that he or she has a heart murmur. And at that point, it's wise to seek out a cardiologist. A general practitioner veterinarian is someone that you should always use as your first resource, but the cardiologist is the one who is a specialist for heart disease. I spent my life as a math teacher, and if you had a math question, you could come to me. I'll be very happy to help you, and I think I could do a pretty decent job. But please don't ask me anything about the War of 1812, or photosynthesis, or how to diagram a sentence, or anything that's not in my field of specialty. Seeing a cardiologist can be expensive. You can save money if you can find a clinic nearby that you could drive to. At the clinics, you get to see the cardiologist at a greatly reduced price because a whole group of dogs are coming to see the cardiologist in one place, and they get to see quite a few more than they would normally in their office practice, and so they give you a discounted price. The first thing your cardiologist will do is called an auscultation. That's just listening to the heart on a stethoscope. A cardiologist is trained to grade that murmur on a scale from 0 through 6, 0 being no murmur and 6 being an extremely severe one. If you determine that the grade of the murmur is 4 or less, and if your dog is not symptomatic, not showing any signs of lethargy, not doing any coughing, which would be a telltale sign of advanced heart disease, you probably would not need to go any further. That's my practice. That's what I do. If I have a grade 4 or less, I know that my dog has some symptoms of heart disease, probably a mitral valve problem in Cavaliers, and we just keep rechecking that every 6 months to a year. If the murmur is a grade 5 or 6, then we take the next step. The next step would be to have the cardiologist do an echocardiogram. An echocardiogram will be significantly more expensive, but it's still something that's totally non-invasive, doesn't cause the dog any pain or discomfort, places the dog in no danger, but it gives you a picture of what's going on inside the heart. That will tell you, by the way, I hope, while I'm explaining this, I hope you enjoy seeing Bootsy and Apple running around the backyard chasing birds. The echocardiogram will tell you if there is any regurgitation through the mitral valve. Regurgitation meaning that instead of just flowing in one direction through the mitral valve and then the valve shutting so that the blood can't go back toward the heart, it will allow some of the blood to backflow. And the degree of regurgitation will give you a much better indication of how severe the heart disease is. They also look at enlargement of the heart. Specifically, they look at the left side of the heart. And if there's some significant enlargement, that could also be a symptom that there is some more advanced heart disease going on. So to tell you a story about Boo and Tag, both of them presented with a murmur that was detected by our vet a few months ago. Again, both of them had something upwards of maybe a 4 to 5 grade murmur. So we had an echocardiogram done. With Tag, the echo showed that there was mild to moderate regurgitation through the valve, and also that the left ventricle was slightly swollen. She was not in congestive heart failure, though. Based on that data, the cardiologist recommended that we put her on a drug which is called pimobendan. That's the generic name. The brand name is Vetmedin, and she wants to get off my lap too. Just watch those two running around the yard behind me. It'll be fun. The pimobendan is a wonderful drug, and since it's come on the scene, it's allowed us to really extend our Cavaliers' life when they do face heart disease. It can slow down the progression of the disease, and in some cases even reverse the severity of the symptoms. If there were signs beyond that, that the heart was significantly swollen, that she was beginning to go into congestive heart failure, that's not an immediate death sentence. There are other drugs that can be given, usually diuretics like Lasix, drugs like enalapril, and those will help to control the other symptoms and give the dog a few more years of life. So with Tag, we are going to continue her on the pimobendan, and we are going to monitor her heart at the cardiologist every 6 months to a year. Boo also went to a cardiologist, also had an echocardiogram. The echocardiogram there showed that she did have some mild regurgitation, but there was no significant enlargement of the left ventricle. There was no sign at all of anything like congestive heart failure. And for her, the cardiologist recommended that we do absolutely nothing except to just monitor her and bring her back occasionally to check to see if the disease has progressed. But she's not even at the point where she needs the pimobendan to help lessen the severity of her disease. So if you have an older dog that is showing signs of heart disease, or even if your dog is not showing any signs, but you're concerned that it could be a problem, start with your general practitioner vet. If a murmur is detected, go to a cardiologist, get the murmur graded. If it's a severe grade murmur, such as a 5 or a 6, have the cardiologist do an echocardiogram and then make recommendations for treatment if it's necessary. So, hope that was helpful to you, and stay well and make sure your dog stays well.